The Eastern Cape Health Department statistics show there hasn't been a COVID-19 related death in the Nelson Mandela Bay Metro since the 2nd of July. However, the municipality recorded 76 funerals for COVID-19 patients in the same period. The conflicting numbers are raising questions about the reporting of deaths in the Metro and in the province. We're now joined by the Eastern Cape's Health MEC, Sindiswa Gomba. MEC, good evening to you. Thank you so much for your time on eNCA. The Eastern Cape is now sitting with over 65,000 cases of COVID-19. You have about 871 deaths. How are you responding to the surge in cases? Is the provincial health system coping?
Yes, we are dealing with the surge and exactly sticking to our strategy of ensuring that we're following up on our cases in terms of both first-line contacts and actually the index tracing. What then we are doing, we are linked to a system that immediately gets us results from both NHLS and NICD, such that we're linking our own people on such a system, both for monitoring and ensuring that we're able to get our people out of the system and record as possible what is it that we are getting from such exercise.
If you are coping, MEC, why did the health minister then send a team of experts last week? They have highlighted shortcomings in health facilities in the Nelson Mandela Bay. They are worried about the lack of infrastructure, equipment and human resource to meet the clinical demands. They also found there's weak management. So it seems public hospitals in that province are not able to respond effectively to this pandemic. That doesn't really sound like a province whose health system is coping.
Let us be specific to actually address the issues of Port Elizabeth, to be exact, the Nelson Mandela area. Nelson Mandela has a history of having its own CEO, particularly in the Livingstone Hospital, being suspended for quite a long time, even long before I came into the system. It is only now that we have dispensed of the case and the termination order has been signed, which starts to make it possible for us then, therefore, to put an acting person permanently and start a process of employing the CEO. That in itself gave us a challenge in Livingstone of having so many vacant positions in management, and those issues are only the issues that from yesterday I've been in Nelson Mandela to try and address. As such, I've taken on board the acting of Dr. Mtandeki Kamlashe to be in place in Livingstone, whilst on the other side we're now going to be embarking on employing the CEO on a permanent basis. We must agree that the Minister Mkhize did come into the assistance of the Eastern Cape. It is not precisely because we're not coping, but rather to actually deal with the issue of us having some particular areas like the people that we're not able to have. And those people were given from the national office to actually assist us in terms of both the areas that we're not able to deal with, and secondly, to come and strengthen the Nelson Mandela area. This is the reason that as a province, the Premier has also actually started to look at a project management unit led by Dr. Zungu and of course assisted by Mr. Tom, assisted equally by, by other factors in terms of health.
Let's talk about the deaths that have been reported in Nelson Mandela Bay since the 2nd of July, MEC. My understanding is that official records from your department indicate that not a single person has died from COVID-19 in the Metro in the last 19 days, bringing the Metro's death toll then down to one of the lowest in the province. Is that the case?
Yes, we've picked that up in the working since yesterday, precisely because our working is together with everybody who's involved, trade unions alike and everybody else involved. We picked that there's stagnation in terms of figures. We have not been recording any. However, when we dealt with that, we do have some partnership working together with the municipality in the area of Nelson Mandela. And when we picked that, we said it is not a matter we can easily say this is the number that we're conclusively having, but rather let's get into a kind of an investigation that shall be completed tomorrow and be able to give us the exact numbers and what happened, whether it is a matter of carelessness. Consequences will then be coming on board in terms of such cases, because we are mindful of the fact that it could be human error that happened, but it is too costly for the province to be human error. Definitely, something that happened must happen, and something that happened must be corrected. But at the same time, we don't want to be hastily getting into conclusions as to what happened. It is for that reason that we're asking to just be given time until tomorrow so that we fully investigate what happened. Then we come back to you and tell you exactly what we found, how many now are the numbers conclusively, and what action are we looking at taking.
All right, so then that investigation will deal with this discrepancy of your records finding that there hasn't been any death in 19 days, and also the Nelson Mandela Bay records showing that there actually have been 76 burials of patients who died from COVID-19. We'll wait for that, the outcomes of that investigation, MEC. But let me ask you the last question about the medical scooters. There's been a lot of confusion around whether or not the scooters would be able to be used to transport patients from hospital. You said, together with the Health MEC, when they were launched, that they would be used to transport patients. The Health Minister has since said the scooters don't meet the basic criteria to transport patients. Were you misled?
My understanding is that it is possible in any venture that you want to get into. However, it is quite prudent to underline the fact that the scooters themselves are going to be taken onto a kind of project that will then be able to say to us, we are pioneering the project. But being misled or not misled at this point is a matter which I believe is past us. We have, to a certain extent, sat together with the portfolio chairperson, agreed to say, let's pursue the scooters, but pursuing the scooters, let's take the side part of it, which actually would mislead us to be transporting people, and look at the scooters for our CCMDD program. And in so doing, as we deal with the project and pioneering it, all other areas shall be issues that we can take on board conclusively altogether, and that then, of course, will be a benefit to us and for the people of the Eastern Cape.
So what's going to happen going forward? Are you going to take the other part of the scooters that has the drips and the beds out, or are those going to remain?
We're looking at all that as guided and assisted by the portfolio committee chairperson and the committee in full. We've engaged now on the basis that most people were talking about the scooters and their prices on a post-award negotiation back to the service provider. Fortunately for us, we had not started paying, we had not started any parting with money from the department, so everything is still under the negotiation. And once that negotiation and the issue of looking at the side part of the scooter dealt with, then we shall be getting on board and still announcing exactly how the scooters are now going to be taken forward.
All right. MEC of the Eastern Cape Health Department, Sindiswa Gomba, thank you so much for your time.